Good evening, viewers and friends out there. My name is Dr. L.G.A, and I welcome you to another interesting episode of Lifeline on NTA2. On the 24th of July 2014, what is termed as the last case of polio disease was identified. And then come 1 year later, being 24th of July 2015, members of health-related organizations here in Nigeria and families who know what it feels like to have a child become paralyzed as a result of the disease called polio, celebrated 1 year without any new case of polio in Nigeria. Now that has become a buzz all around the world, such that even international correspondents have come to Nigeria to find out what did we get right to be able to achieve this feat. And that is why it became important that on this episode of the program, we discuss the eradication of polio, especially looking at the journey thus far. With me in the studio is someone who should know from the grassroots level. These are the soldiers that you will say, or the head of the soldiers of those who needed to send people out there, even going out there themselves to go and try to identify this place and monitor structures such that any new case that could have been there coincidentally will be able to be identified. He is currently the medical officer of health, Etiosa local government area here in Lagos State. Thank you and welcome, Dr. Ayoola Nurain, for joining me on this episode of the show.
It's my pleasure. Thank you, Doctor.
Sorry, I was almost mixing up the name.
No
Dr.
problem.
Ayoola
Yes,
Nurain.
Nurain,
Yes,
yeah.
he is Dr. Ayoola Nurain, the medical officer of health, Etiosa local government area here in Lagos State. Well, before we go ahead with the show, Dr. Ayoola Nurain, let's even find out what some people we talked to out there felt about this disease condition called polio, and how happy they are given this all-important feat that has been achieved by the Nigerian government.
Polio, to my own understanding and according to what we've been getting from sources, is a disease that affects kids underage puppies, and it affects their health, and it has to do with life, because if a polio, if not taken care of, will eventually take the life of the kids affected by this virus. An achievement of any feat deserves a continuation. If you want to continue on that path, you have to just maintain what you have been doing for you to have attained that level. So for us to be free at least within a year from polio cases, it means we have done a lot. So the health sector needs to do more and even bring more experts to the sector for them to improve and eradicate the cases of polio.
The health system in Nigeria before now is in a dilapidated situation, I say. But I thank God for the new development anyway. If the new era of federal government can invest more on health system, I think it will do us good.
The poliomyelitis is a disease, I think, for the small children. If the parents, if they don't take this immunization from ages 0 to 9 months, you know, some parents, they feel unconcerned about all these things. They'll tell you that, oh, God will take care, God will take care. We don't need to be challenging God with what we can help by ourselves. So it makes the children, I think a leg and a arm may be paralyzed or something. And good thing, in our days, when we are bearing children, we have so many of them. But these days, it seems as if the thing is going out of, I would say, out of fashion. So we thank God for the government. I at least, and I will speak to the parents too, especially the young ones who are bearing children now, that they should not forget to take these immunizations as the ages of these children as they come up.
We want to thank the government for what they have achieved so far from the past administration to now. And then the important thing is to sustain it by public awareness, by making sure that if there are vaccines and what have you, that it should be administered. Because most of the time the polio is much more in the northern part of the country because they don't allow their children to go for vaccine. So there should be a kind of an education so that they understand that this is not against their religion, that this is the interest of their children and the interest of themselves.
Polio actually is a sickness that affects children. It handicaps them, probably from their birth, and is not really good for children. It's a success actually to Nigeria and the whole world generally, and I think with time to come, with the modern technology that is put in place when it comes to health, I think such issue will not arise anymore. And if there's any issue of any type like that, I think they will take care of it immediately.
You're welcome back to the studio, and we are talking the eradication of polio in Nigeria, the journey thus far. Now, Dr. Ayoola, a lot of important points have been raised by the respondents that we spoke to on the streets. Apparently, people have knowledge of this condition. Now, just to touch some history quickly before you tell us what happened, what was happening here in the grassroots. Now, the viewers, it's important for them to know that polio is an infectious viral disease. Sure. Now, a virus is a microorganism, and this microorganism can be gotten through the mouth. So polio will live in feces, and then feces infects water that people drink or food that people eat, and that's how it gets into the body. Now, when it gets into the body, it can cause some kind of paralysis. That's just one aspect of it. Though a low percentage, but that's the bad thing, in that people have had to see their children become paralyzed. Now, in 1988, it stated in a WHO article I saw that about over 100 countries were said to have polio endemic status, and then an average of 350,000 children were getting paralyzed every year up until 1988. Okay, now coming to Nigeria, I also came across the fact that in 2001, 51 cases were identified, though in 2001, 51 cases from 16 states, about 14 states being states in northern Nigeria, and someone rightly mentioned that, of course, most of the cases were in northern Nigeria. But the other two states, Lagos had one case. And then we were talking before the show, you had told me that, okay, later on, that there were times that there were 0 cases in Lagos, and then there was time that there was one case, either of the... What was your experience?
Well, first and foremost, maybe I should start by thanking you for giving us the opportunity to talk to the general public about this very important issue.
Okay.
Now, really, you already summarized the issue as far as poliomyelitis is concerned. As far back as 1988, it became an endemic, a global endemic, to the extent that we annually, about 350 cases were recorded, and it got to the attention of the World Health Assembly in 1988, and at that point, they knew that we must do something about this, and an agenda for polio eradication, which we now call the Polio Eradication Initiative, was established. And of course, Nigeria was a party to that, signatory to that treaty, saying that we must be focused at eradicating polio. And of course, if you go back to what some of the respondents said, there was a particular woman that talked about that during the time when they were bearing children, that the cases were more rampant.
Yes.
And now that the cases, at least from even the point of view of a layman, you can see that the things are getting better. So, and just like you summarized in your preview, as at 2003,
yes.
From 350,000 cases per annum.
In 1988?
Yeah, in 1988, it has reduced to just about 400 and something, 87 cases per annum. And right now, as I talk to you, even in 1988, we have about 125 countries where polio virus is endemic. And by year 2003, it has been reduced to 5. And as I talk to you today, 2015, it has reduced to 3.
2 cases, 2 countries actually, because
3.
Nigeria is...
No, anyway, Nigeria is
no,
almost
we are
there,
not free
but
yet.
It's not yet announced.
Okay.
That because there are a lot of things that must go into it before any country can be declared as a polio
free.
So, but by and large, we are still saying that Nigeria is in the club, but we are hopeful that anytime from now, by 2017, supposing that we don't have any case of white polio virus, Nigeria should be out of that bracket. So, and let me say that for us to achieve this feat, a lot of things have gone into that, and of course, and there are lessons learned from those countries that have been part of the club before that are out of it now, and there's what we call the polio eradication strategies. Okay, and talking about that, the first thing is that how do we strengthen routine immunization? And of course, talking about strengthening routine immunization, that brings to mind that polio is one of the diseases that we can actually prevent. It's fastly preventable disease.
Yeah.
So in essence now, since we know that, we are lucky to that extent that we can prevent this disease by at least immunizing
the children.
So the first strategy is that how do we strengthen our immunization such that the target children, because we are looking at under the routine immunization, we look at the under 1.
Okay.
That is 0 to 12 months. Okay, how do they get all the necessary vaccines? And of course, of which polio
is one of them. The oral polio.
Oral polio. Okay. So how do we strengthen that such that if we have a target of 1,000 children and we get to all of them? Okay. So, and the second strategy is that even after we have gone beyond strengthening the normal coverage of all the children within the target population, then we look at issue of how do we do supplementary immunization activity. Like in fact, part of the issue that we have concerning that is that from time to time we have to do periodic mass immunization of the children that
for booster doses.
Yeah, for booster doses.
Okay.
And in fact, sometimes even in some part of the country, you see people saying that this thing is becoming too much. So it is a part of strategy, even though at that time it's not because we are seeing the white polio virus, but necessarily as a strategy just to really make sure that we kill this virus. Even though we are not seeing white polio virus, we must ensure that there are booster doses getting to these children to raise the herd immunity.
Well, Dr. Ayoola, before we even talk more on vaccination, as it were, because that seems to be what has done the magic, such that Nigeria is declared to have been able to interrupt transmission, because like we rightly said, it will take 3 years of no new case of polio before we can say Nigeria is free. Now, even before then, before we had gotten to this status where we are saying the transmission of polio had been interrupted, what are the structures from the local government level that we are put in place to be able to make sure that surveillance was going on appropriately? Because people will have these cases, and then how will people know? How does the local government get to find out?
Thank you very much. And in actual fact, really, the structure is it is a global structure.
Okay.
Talking about polio eradication, it's a global structure. All we need to do is for us to adopt it locally.
Oh, I see.
Do you understand? Now, and to that extent, as I was talking about routine immunization as a strategy, you talk about the supplemental activity.
Yes.
You talk about mop-up. Okay. When you have cases like white polio virus coming up, then the last of the strategy is the surveillance, okay, which you have mentioned. So that means all these four must go hand in hand for us to win the war. Okay, and now coming back to the local government, like I told you, it is a global strategy, and we need to adopt that.
Oh, it's not like the local government has its own separate strategy.
No. It is the same strategy that we have to key into, and that is exactly what we are doing. So, and but particularly, that means at the local government level now, what we ensure from time to time is that you know the total population, and from the total population, you know that how many of them are under one.
Okay.
Okay, so and we ensure from time to time how do we get to these under one children in the population so that they can get the necessary vaccination against polio. And now how do we achieve that? We have the health facility, which people call the health centers. Yeah. And now you know that sometimes some of the health centers may not even be adequate to serve all the general population, and to that extent we need to organize outreaches. Okay. That means we take service out of the health center going to the underserved communities. Okay, the underserved communities, and there we make sure that for those who are not coming to the facility, we get to them in their own
there in the community.
In the community.
Now, so are there town hall meetings where people try to enlighten mothers, especially about some of the symptoms of this condition, and then even talk to them the more while immunization is necessary?
Sure.
In terms of the outreaches.
Yeah, sure. Now, when you look at the structure at the local government level, primary health care as a department.
Yes.
Okay. Now, part of one of the units in the primary health care department is the health education unit.
Okay.
Okay, and of course, it is a teamwork. You know, the fact that we are talking about immunization doesn't mean that the health education will not be involved, because whatever information that must necessarily be passed to the community people must be anchored by the health education unit. Okay. So there's what we call community dialogue. So that community dialogue is like a town hall meeting, which you call town hall meeting.
Yeah.
Now, and with targets, we look at, okay, which of this community that we need to go and talk to from time to time. We draw a timetable. You know, local government has a fraction of wards, and then we can now take the community dialogue to all the wards in the local government. There will be a plan, an annual plan, to take discussion to health-related issue. And now, as far as polio is concerned, we've organized several community dialogue. It is still ongoing. You know, do you remember there was a time people are even saying that this excessive, what they call excessive vaccination can lead to infertility? You remember it was...
well, there were myths.
Yeah.
I'm going to talk of that when we talk of the challenges.
And all of this, as the issues are coming up, we'll make sure that we organize what we call community dialogue, where we meet the opinion leaders, the religious leader, the traditional leaders, the CDA, the CDC in the community, where we bring them together, the caregivers, the mothers, you know, women of childbearing, where we gather them and we talk to them about issue of polio. Why? And let them know in the first instance that even there's nothing like excessive vaccination. Okay, the more that any of these children have the opportunity to get the vaccine, the better for them. So it cannot be too much. There's nothing like too much of a vaccination as far as polio is concerned. We let them know that.
Yes, I was going to come to that in terms of the challenges, because I came across literature where the head of the Rotary Club, or the lead of their anti-polio campaign, was talking to some Time magazine journalists, and then they mentioned how we could have gotten to this status a while back as Nigerians, in terms of even polio should have been eradicated. But at a time, some particular members of society were carrying out beliefs that vaccinations, especially for polio, were not good. That either these things had to do with HIV, or these things would make the children sterile. They will not be able to have children. And then, still talking about challenges, he also mentioned the issue of Boko Haram. There was a time where Boko Haram was reported to have killed 9 health workers who were out to vaccinate children. And that brought to my mind, now this seemed to be happening in northern Nigeria. Here in Etiosa local government, what are some of the challenges that you people face?
Yeah, well, I must let you know that, of course, particularly when you have to do with public, there's no way you will address issues like this, you know, that there will not be challenges. And the truth of the matter is that there have been challenges. And part of the challenges, of course, like you talk about the issue of polio and sterility, people becoming infertile. It was almost becoming a national issue, you know, such that the concerns are coming up. You know, this one will hear it and spread it to another.
And this thing was stalling the program of trying to eradicate.
Yeah, it was stalling the
condition.
Program. So it was a big challenge at that time. But of course, we were able to rise up to the occasion. And but one thing that is very critical when it comes to community medicine is the fact that if you know how to do your community entry very well,
community entry,
yeah,
yes,
such that you are able to meet the opinion leaders. You know, some of these people, and in fact almost all the time, they almost get the answer once they are convinced themselves.
Then
it becomes very easy.
the idea just flies for the followers.
Yeah, exactly. So we were able to get around that, you know, knowing what to do. And what to do was just for us to be able to talk to people, the opinion leaders in the community, and they were able. So, and beyond that, you know, when you even look at a point, because it's a massive campaign that we do, you know, particularly when you talk about the NID, the National Immunization Plus Days, where we have to get a lot of people. It's a mass program, and the number of health workers available, human resource for health, could also be a challenge sometimes.
Could be a challenge.
Yeah, you understand? So such that we need people from outside for as long as they are trainable.
Volunteers,
yes,
and
you know,
what
oral
have you.
polio sort of and all of that. So, and you know, even as we talk now, human resource for health for such program could still be a challenge, because by the time they now look at the effort they are putting in and the money they are getting in return, you know, volunteerism is something strange in Nigeria.
It is.
You know, yeah,
it's not very popular.
Yes. So they really want to, you know, assess what they are getting, you know, with what they are contributing. And to that extent, they feel that some of them for working for 5 days, and at the end of the day, they're getting this. So that one is,
not enough money,
not
isn't
enough,
it?
Not enough money for their service. It could become a challenge, so that when you need like 20, you may be getting 15, 10 people to work, and of course, that means the coverage can also just be affected.
Well, the like I always say, the time is not always enough to adequately trash some of these issues. But viewers and friends out there, I'm sure you have been listening to us. All of what we have been talking so far is not just what happens in Etiosa local government, like the medical officer of health here, Dr. Ayoola, has mentioned. This is a global initiative, and all we need to do is just to adopt such an initiative. I'm sure that you are listening from different local governments across the country. I hope that these things are going on in your local government as well. Remember that polio is a disease we don't want to affect our children. And right now, we are at the situation where it is said that we have interrupted transmission.
Sure.
And then if any other case comes up between now and 2017, we're almost like back to square one, where we have to try and start pushing again. But right now, you have to keep taking your children out for immunization. Talking about the symptoms, of course, polio is something that could come up with fever. The child could develop a cold. The child could develop some muscle pain in the arms and the leg. Want to see anything like that, rush and take your child to the nearest health center. But most importantly, vaccination does not do any child any harm. Yeah. Instead, it does the child all the good. Dr. Ayoola, just one word for the viewers. What do you think they should know out there so that we can round this up?
Yes, well, thank you very much. Again, it's an opportunity for us to just continue the education that we've been giving to the general public. Now, as far as polio is concerned, we already know that it's a viral disease. We know that it's transmitted fecal-orally. That means, you know, the child...
Hand to mouth.
You know, and that in the long run, and what we fear is that this polio can lead to paralysis. And for those who are so unlucky, it can lead to death. So, and that now that we know that we are lucky enough to have it as a vaccine preventable disease, and these vaccines are available everywhere, free of charge. You know, it is an opportunity for me to appeal to the general populace, particularly the women of childbearing age, to make sure that your children get fully immunized, particularly against polio. Virus.
Thank you, Dr. Ayoola, for coming on the program. It's been a pleasure speaking with you. Well, I'm afraid this is all we can take on this episode of the show. Until same time next week, ensure to have a blessed time out there.